You're talking a little bit about the challenges with communicating directly with the patients, but yet they're not the only stakeholder in this, right?
No.
There's always family. There's there are other people that you need to communicate with.
Yes.
Talk a little bit about the challenges that you have in keeping everybody in the family or other stakeholders on the same page.
Sure. So usually we try to send individuals home with information. A lot of that is, the printed page.
Yeah.
Pictures and descriptions of exercises or instructions of what to do on a daily basis. Even though you go over it with the patient and they don't always grasp exactly what you're shooting for. And when they do go home, sometimes it's somebody else that's reading that paper, trying to interpret it as well, who's never had the opportunity to communicate with myself. And so sometimes, again, you get those random phone calls.
Yeah.
Then you're playing phone tag again, trying to answer questions and to help them along. Because, the healthcare journey is just that. It's a journey. From the hospital to the subacute world, from the subacute world to home. It's something that is a process, and many, many different individuals are involved in that. And even though sometimes some information is passed along via a printed page, but a lot of it is lost through that journey.
Yeah. Well, the interesting thing, I love how you talk about it being a journey. It's a journey for the person that's going through it, and yet we parse it up. We slice and dice it into, okay, they were in the hospital. They were in the surgery center. Now they're in this post-acute space. Now they go home and maybe they've got some home health. What's the same life for that human being? And yet far too often the ball gets dropped with communication. Again, by no means the fault of the individual. I think individuals involved, we just don't have a great system in place or a technology that allows a seamless conversation, right? I think that's where the biggest challenge is everything that we're doing right now is independent and not necessarily patient-centric.
Very much so. That's like challenges. I mentioned use of computer software to help you along with our documentation. Well, the hospital uses a different software package than we use. They don't talk to each other. They don't get along. Yeah. And then we send them on to home, and maybe they're working with home health therapy. Well, they don't like to talk to our software either. Right. So again, lots of things get missed and get dropped along the journey.
Yeah. Again, by no fault of anybody involved. It's just we don't have the system put into play that can allow people to do that.
Exactly.